Dr. Sherman, could you discuss briefly the potential interactions between medical cannabis and other medications that patients should be aware of?
Okay. Yeah, absolutely. So I'm a pharmacist, and I will say that, I've spoken to fellow pharmacists about this, and it's very difficult because, we've got a program that, we can look at to see what medications that patients are on, and now we can see what, if they're on taking medical cannabis and things like that. And so we can look at, drug interactions and things like that. Now, the problem is that there aren't concrete studies for everything that there are purported interactions with. So, for example, benzodiazepines and antidepressants, like Callie just said. So those are some major things that there are interactions with, but we don't know the extent of those interactions. So, for example, I forget the benzodiazepine that actually has been studied for cannabidiol and for the interaction between that. But one of the studies that we're going to be working on over the next 2 years is going to be looking at different benzodiazepines and whether or not that's a widespread interaction.
Understood. But there are interactions between cannabis and other drugs that patients are taking, and it's important.
Sure.
It's important.
There's an interaction with Coumadin. Coumadin is not as well used anymore, of course. I actually did a Coumadin clinic back in the day, but we've got DOACs now, so so we don't have to use Coumadin for everybody. So, but there is definitely an interaction between that.
Got it. It's important to discuss with your medical doctor your use of cannabis, and medical or otherwise, because
Absolutely.
There are interactions between drugs that you could be taking.
Right, and your pharmacist.
Yeah, absolutely.
Yeah.
Tatum, what measures does Root Down take to ensure product quality and safety for patients?
Well, that starts before we ever purchase the product. We vet the people that we buy products from, go on tours if possible. Some won't let you in, most will. Then come samples. We try to get samples first so we know what we're looking at. The regs don't let you look at it in the dispensary, so you kind of have to have a sample to judge what's out there, what the quality of the product is. And then once it's in our stores, we practice FIFO, first in, first out. We want freshness to be key. It's important to us. We feel like it's important for the product's efficacy. So that's something that we strive to do. Keep the freshest thing, move out the old first. With regards to safety, that really comes down to testing in the COAs, and then the transparency of those, availability of those, letting a patient know if something's on discount, it's because it's aged. We let them know the effects of products, the dosage amount, go slow, start slow. And then all of that boils down to education. We want to educate and guide people through this process so they don't hit walls, so they don't quit too soon.
I think, just as important as having a good relationship and open dialogue with your practitioner, I think as a patient, your next, best person is your bud tender, is your wellness advisor. So developing a good relationship with people like Tatum, well, Tatum's not a bud tender, but Tatum's bud tenders, that's your next line of defense for, as a new patient, trying to find products that may work for you. So the relationship between your doctor and your bud tender is both important.
And then from the store level, we do keep our inventory rooms at 65 degrees. We do keep all of our products in a separate bin, away from other products. We do monitor harvest dates, and we try not to purchase things that are going to put a patient in a position where they've got an older product.
Callie, what are some of the most promising areas of cannabis research that could benefit Mississippi patients here in the future?
Yeah, so I think some of the most promising areas are definitely going to be some of these real world outcome studies we're doing, where we're going to actually have some good clinical data on the closest you can get in a Schedule I environment to having some evidence that these products are working specific for these conditions. And what's really cool about the studies we're going to be doing is we're not going to just be looking at cannabis in general. We are actually we've got a really powerful company tool we're working with where they're going to be looking at the actual cannabis profile. So when a patient goes in and they're signing up and they're doing this study, there will be a daily checklist they'll go through where they report on their symptoms, and at the same time they will also be uploading which product they're using specifically, so that we can see, okay, so for this condition, it's not just, okay, cannabis is helping, but it's this specific cannabinoid profile, whether that's CBG, CBN, plus THC, if it's a 5-to-1 ratio, a 2-to-1, things like that. So we will actually have something as close as you can get to clinical trial in this environment with that. So I'm really excited about what that's going to do for the conditions, for the industry, and of course, as we're finding this evidence for these certain conditions and certain profiles, that will immediately segue to, okay, well, this condition is in a similar family, or this cannabinoid is kind of similar here. And so I think it will really open up the landscape for what we're able to study without even really expanding on a whole bunch of different things. Do you have anything you want to add to that, Dr. Sherman?
Yeah, I definitely want to piggyback on that.
Yeah,
and
go for
say,
it.
You know, what we're doing are randomized controlled trials. Okay.
Thank you.
So, and that is like the highest level of evidence that you can have. So, you know, basically, being a pharmacist, I know that, you know, all the medications that are FDA approved, they have to have randomized controlled trials. Good, long, lots of patients in these randomized controlled trials for a significant length of time for that drug to be approved. And so, you know, what I'm excited about is that it's going to be at that level, you know, that we're working on with the NCCRE. So I'm really excited about that.
Yeah, that's amazing. Diesel, how do you see the Mississippi medical cannabis industry evolving over the next couple of years?
I'll piggyback on what they're saying. When Callie did her speech earlier, she explained how whether it's medical cannabis or adult use, it's the intent that is the difference. But because of all this research that is being done, because of all this new information that'll come out, you're going to start seeing producers make products to specifically target those conditions. Once that data is out, everyone will understand how they should make it to better help the patient. That's when we're really going to see a difference in between what we call adult use and medical cannabis. Recently, we've been able to isolate THCV, and one of the jokes about cannabis use is it always makes you hungry, but THCV is actually an appetite suppressant. And so someone can now isolate that cannabinoid, use it in a product, and essentially help in weight loss with a patient while still giving them some of the relief of pain or joint tension, whatever it may be. So I think the big change is we're going to get so much data that the producers can dial in the products to where the customer's like, you nailed it, instead of the customer doing a lot of searching and finding. I think we're going to be a lot more pinpointed with the products.
Sure,
Yeah.
that's really exciting.
Yeah.
And that'll help with that cost point too, because part of the most expensive part of being a cannabis patient is the trial and error process to figure out what products are going to work well.
Right.
And I'll piggyback on that and
Yeah.
say that there was a medication actually out about 2012, 2013. It didn't get FDA approved, but it was called Ramonabant. I don't know if, do you remember Ramonabant when it almost came out? But anyway, it was
It was Marinol 2.0.
Oh my.
well, it was a CB1 antagonist. So just like you're saying for THCV, which is
Right.
a CB1 antagonist as well, and it, I mean, I read the studies; they were really good studies, and they showed that it was beneficial. So
Yeah.
I'm very excited about THCV as well.
Yeah, absolutely.
For that.
Absolutely.
Yeah.
David, what advice would you give to patients who are considering medical cannabis but are hesitant due to a stigma or a lack of information?
I would say talk to somebody like ourselves or somebody at the dispensaries. You have a lot of people that are very, very knowledgeable in Mississippi now. So it's touched a lot of people as well. The whole state ain't got 3.3 million. So, you know, and everybody's using kin to everybody around here. You know how that kind of goes in office. But, you know, you'd be amazed because what happens is that guy next door is like, well, Bob's over there. What's Bob been doing? Bob's been out there mowing the lawn again. Well, come to find out, Bob's been over there doing his edibles over there. So then Janice comes by, and then Janice asks, well, Bob, where'd you get that from? What you been taking? Well, that was that, you know, that. So the word gets back. And every time you see a good result, it always comes back. So if you're hesitant, come back and ask. Talk to us. A lot of people call. I've had people go all the way, spend 30, 45 minutes in office with me, and get to the end of it and go, yeah, I'm good, Dave. I was like, we'll think about it, I'll come back. And they usually always do come back. We're not one of those people. I enjoy talking to people, probably too much sometimes, get myself in trouble. But, and then we don't charge for that. We'll try to answer whatever we can. If I'm not busy, I'll always come out and talk. But there's a lot of good dispensaries, a lot of good people in the industry who are very, very knowledgeable. And like they said, the research is going to prove some of that. And when you get proof to what's actually going on and what you're seeing, then you're now changing the dynamics of everything. And then you'll really see some movement, like they said, tailoring it in. And now we're going to be able to go, oh yeah, well this is this, boom. And that's going to be very, very helpful. So now get more of a playbook too. But if you're hesitant, come back, talk to us. You'd be amazed who probably is using or has been using for multiple years. And you know, there's the, you know, if you see me, I'm not gonna say anything in town anyway. If you did, if I saw you, I'd just wave, get a lot of those. Like I say, so I was like, hey, he's not going down. So it's like, just keep on trucking. But, you know, if you're hesitant or even thinking, just find somebody, reach out, talk to them. Callie's got a lot of stuff, and that's where that educational material will come in as well in the future to show everybody about it. So, but those wins and those stories in Mississippi are really, really effective. So,
Callie, can you explain the importance of the seed to sale tracking system and ensuring patient safety?
Sure. So the seed to sale tracking system that Mississippi has adopted right now, it's called METRC, METRC. And I can't remember exactly what it stands for, but it's something tracking, and compliance. And it's exactly what it sounds like. So literally from the time that plant is either 8 inches tall as a clone, it gets a tag, then that particular plant is tracked throughout its life cycle through cultivating from room to room even. Like at any given point, I could have logged into METRC, and if you told me I want you to find the plant with this tag, if a cultivation facility is set up right, I could literally walk in there and within moments locate it as to within a couple of square inches of where it is. And then it goes all the way through. You can follow that plant through the testing, through the processing, all the way to the point to where it is sold to that end user, to that patient. So I could literally, if a patient came in and said, hey, I'd like to know where my gummies came from, I can tell you down to the square inch of where your gummies came from. So that is really important because it does allow for that level of accountability, that level of transparency, and also just to make sure that if any given point there's an issue with that product, it makes it a lot easier to find that. So that is very important to the safety and the compliance, particularly in the testing phase. That's where we want to make sure things sail through appropriately at that level. So it's really integral to making sure that patients are protected.
Absolutely.
Yeah.
Our industry professionals, Tatum and Diesel, what innovations in cannabis products or delivery methods are you most excited about for patient care here in the future?
Drone delivery. Nah, I don't think they're going to do that yet. I don't think they're going to do that yet. As far as delivery goes, there are no new changes, but there's been some conversation about maybe allowing delivery to people who are homebound, hospice, hospital, nursing home. That's a really good conversation, and maybe we'll see something like that next year. But product innovation kind of just goes back to what we keep talking about. We finally have people who are serious in their field and they're studying cannabis. And we're going to get real results and understand really what we can do to target different conditions. And so again, kind of the same answer, but that's where we're going.
Sure.
To add to that, I kind of want to flip that back a little bit. To me, the program itself is the innovation, because the delivery methods, they're all out there. We know what it is. We know what's coming, what's not. Sure, there's some new butter balls that you can put on your toast, and there's hazelnut spread that you can put, you know, with your jelly or whatever it is. But to me, it's the program itself and the access that the program brings, the education that is allowed by the program's existence. And that creates a system or a place where a patient can go and try new things safely, understand exactly what they're trying, why to do it, how to do it, and then journal about it. Provide feedback. That's where products get better, through patient feedback and journaling and understanding what's happening and why.
Absolutely.
Can I add something
Yeah.
to that?
Sure.
I just want to mention, you mentioned the journaling and how important that is, and he's absolutely right. I kind of failed to mention this. So the app we're going to be using for our real world outcome study, it's called the Relief app. It's actually already ready to download. So our study will be an integration in that, but it's already in existence on the app marketplace. You can download it, and they call it kind of your cannabis journey journal. You can go in there and go ahead and
Exactly what you
self-log
said.
what symptoms you're having, what products you're
Yeah.
using, what relief you're experiencing.
That's what's up.
So that's a really cool journaling and tracking tool that patients can be using.
Yeah, we have them. We offer them to our patients.
Good deal.
They can
Great.
come in and they got their journal. Also, our point of sale system has a journaling and a
Neat.
profile where if you exclusively, which I don't suggest, but if you do, we can track everything you've done in our store and help you understand, okay, these are the ones you got last time, which ones worked, which ones didn't, and push that information and help them navigate this journey.
That's awesome.
Yeah,
That's
I love
great.
that.
That's amazing.